Welcome to the Health Science Podcast, sponsored by the National Health Association. I'm your host, Dr. Frank Sabatino, and today I'm delighted to have as my guest Dr. Zach Burns. Dr. Burns is an osteopathic medical physician. He is board certified in family medicine. He is the assistant director of a very important organization called Moving Medicine Forward that was created by my dear friend and iconic physician, Dr. Michael Klaper, and we'll talk a little bit about his role and the purpose of that organization, which is really to train a generation of physicians in the power of plant-based medicine, basically for really dealing with the burden of chronic disease, reversing and preventing these problems. So welcome, Zach. It's such a pleasure to have you.
Welcome to the Health Science Podcast, brought to you by the National Health Association, the oldest organization in the world championing the extraordinary benefits of a whole plant food diet and healthy lifestyle, as well as water-only fasting. We believe that health results from healthful living and focus on evidence-based science that promotes the health of you and your loved ones, as well as the health of all animals and the environment. We feature experts from a cross-section of disciplines within the plant nutrition, vegan, psychological, environmental, and animal compassion sectors. I'm your host, Dr. Frank Sabatino, the NHA's Director of Health Education.
Thanks for having me, Dr. Sabatino. It's great to be here.
I always like to start off giving people a little bit of a background, and I noticed that you made the point in the history that I looked at that in college years is where you made the transition to being an herbivore. I like the way you wrote that. And so that what were the triggers in that early stage of your life that kind of moved you in that direction?
It starts with my parents. We grew up without red meat in the house. And so I had some early sentiments of environmentalism and health. We didn't do red meat, both for the planet and our arteries. But we ate lots of chicken, turkey, fish, dairy, eggs. My favorite foods in high school were pizza and ice cream. Sometimes after track practice, I'd have plenty of both. And it was like cute, right? It was a virtue to be a fit looking teenager and just pound dairy products. And then I showed up in college and started taking some classes that were enlightening and pretty dark. I took a class called American Food and learned about factory farming. Really, for the first time, I fully accepted what a factory farm is, where our food comes from when we're eating animal products. And it was pretty upsetting. And early on, I stopped eating meat. So I became vegetarian freshman fall. Then, let's see. So it took me a few years before I went fully vegan. There were a few different factors. I don't know how long you have here, Dr. Sabatino.
No, just go into it. Sure. I think people, they want to know.
Sure. Well, sophomore year, I became a philosophy major, and my advisor was an animal ethicist. So her branch of philosophy was moral philosophy. And then she applied different moral philosophies to contemporary issues, namely the exploitation of non-human beings. And she really turned my world upside down because I was able to re-examine my relationships to other species. And I realized that we had learned a lot of junk about our superiority to every other species, and that speciesism functioned a lot like all the other prejudices, sexism, racism. And that we had some unlearning to do. So once I realized that having hooves or a tail or wings doesn't fundamentally make a being of less worth, then I had space to actually decide how I wanted to recreate my relationships to these beings. And it's sort of basic. One thing you can do is to not eat them and pay for them to be raised and slaughtered. And I feel lucky to have had this exposure. Not everyone gets to take philosophy classes and think deeply about our food system. So using that privilege, made a personal change. And then over the years, I decided to make this my career. In
Well,
medicine,
I noticed early on from that you had occupied your time dealing with some health centers in like the eastern part of Boston. I read that, and you said that you were working with Hispanic community at that time and started to be aware of the social burdens and the obstacles for people that did not have the education, money, or food accessibility, and how those obstacles were playing into their chronic disease outcome. And I saw that kind of seemed to be a fairly decent motivator for you to want to pursue that further. Is that correct? I mean, was that a driving force for you, that experience working with those populations?
Right. So you're referring to one of my first full-time jobs out of college, which was through AmeriCorps. And they set us up at a community health center. This one was East Boston Neighborhood Health Center, an immigrant neighborhood. And basically I was a makeshift social worker for complex primary care patients. And it was a lot. I learned a ton. It was mostly in Spanish. So it was like a crash course in Spanish, which I'd had some foundation in, but and people were really, really struggling. And this was, it was, let's say 15 miles from where I grew up, but the life experiences of these people were just completely different. So I was very humbled. I was saddened by a lot of people's situation. They were getting deported, they were getting evicted, right. They were relapsing on drugs, and so it kind of spanned into the working class and perfectly middle class. And I saw plenty of foodborne chronic disease. And that was my first taste of that issue, formally, as being a sort of provider. And I said, this is not sustainable. But virtually everyone who came through our office had a preventable chronic disease. And I was starting to learn about the role of diet in this situation. It's not just an accident that our society has become really chronically ill. It's what we're eating. It's the stress that we have to undergo. It's the lack of sleep. It is the sedentary lifestyle. Your podcast listeners know all this stuff. But I realized that if I want to practice medicine sincerely in the future, I was pre-med at the time, but I want to tackle the chronic disease issue. Some people, we need our specialists. We need people who are doing, a really intricate ophthalmologic surgery and different, but that's not my thing. I'm big picture. So where is the most egregious public health issue? And let's see if we can make a dent in it.
At that point that was before you actually went to medical school. And I noticed that you had a little fascination with Hispanic culture. So what was the interest to you of Hispanic culture? What attracted you to that culture?
Yeah. So as mentioned, in East Boston, a lot of our patients were from, especially El Salvador and Colombia. And there's this warmth, one of my roles after the AmeriCorps term, I stayed on at that health center and I worked in an HIV clinic there at the same clinic where I was the only non-Hispanic member of the team. And man, that was a blast. They teased me. I was this lame kid from the suburbs. And we had a blast. They're just so warm and inclusive. One thing that stuck with me is one of my colleagues, he turned 42, and it was his birthday, and he was really vibrant about it. And lately I'd been spending time with more like sort of middle-aged colleagues, and they were always bashful about their birthdays, and not this guy. He was fired up about it. And I asked him once, why aren't you one of those people who plays down their birthday and doesn't want to feel old? He said, why? Because in Colombia, we were walking out of a nightclub and 100% of my best friends, this big group of friends, were murdered. And I survived. And so he's like, each year is a gift.
Wow.
And so it was, it's like their life experiences, their attitudes that I found really powerful. So I tried to carry some of that with me, and my treat to myself before med school and after these jobs was to visit Columbia itself.
Wow.
Yeah, I don't talk about this much, but I did 2 weeks on an organic vegan farm outside of Bogota, and
Wow.
it was beautiful. It was like a combination of a animal sanctuary. There were rescued goats and chickens and horses, and also this farm that was providing food to the community, including for doctors who would come once or twice a week to get their provisions and pass them out to patients. So it's not just, in the US and in wealthier countries that plant-based nutrition is practiced, right? This is an ancient tradition, and it's sort of, the West is kind of rediscovering the merits in the context of a big public health issue.
Zach, let me ask you a question, because while you made the point that while you were doing that work with that population before you went to med school, you already had a kind of an interest in the chronic disease situation. You wanted to address that, and you saw that as kind of something you wanted to kind of move into in your medical attention, in your medical focus. Were you aware at that point that many of the doctors dealing with those issues were really more disease managers rather than true healthcare providers, meaning that they didn't really see how lifestyle could effectively prevent and or reverse those issues? Was that something already coming into your consciousness, or had that not really entered yet? Where were you in your thinking process at that time?
I wasn't fully aware when I was in my pre-med years of the situation in which someone is diagnosed with a new condition, blood pressure or diabetes, and the mainstream or conventional response is to basically immediately put them on one or several medications, which would sort of dampen the physiology and maybe can correct the numbers for the time being. I did not appreciate that was going on, and it was only once I got into my clinical years of med school that I saw how we were actually addressing chronic disease, and it made too much sense. The chronic disease numbers have increased almost exponentially since the 80s. And in the meantime, that's the time during which we've started to eat worse collectively, move less, and that pharmaceutical products have had their record sales. So, but it took until med school to really be there in these exam rooms and see how practicing docs went about it to appreciate the situation.
Yeah, we're going to take just a very short break. I'm here with Dr. Zach Burns. We're going to take a short break to hear from our sponsor, the National Health Association, and we'll be right back.
You're listening to the NHA Health Science Podcast. Dr. Frank Sabatino here. Are you ready for an extraordinary adventure that combines relaxation, exploration, and vibrant health? Then set your sails for the NHA plant-exclusive cruises. Imagine cruising through exotic destinations, savoring delectable plant-based cuisine, and engaging in rejuvenating activities, all while surrounded by like-minded individuals passionate about health and wellness. These cruises offer more than just a vacation. They offer an opportunity to immerse yourself in the NHA's principles of healthy living. And they rank incredibly high on the ratings of eco-friendly cruise lines. We all know how important our oceans are, and our cruise partner, Windstar, is fully committed to this. Join us aboard our upcoming plant-exclusive cruises and experience the synergy of health and leisure. Delight in gourmet, SOS-free meals prepared by talented chefs. Attend informative workshops and enjoy the serenity of the sea, all tailored to nourish your body, mind, and spirit. For more details and to reserve your spot on our next adventure, visit healthscience.org and click the link under travel. Don't miss this chance to indulge in a wellness retreat like no other. Elevate your well-being and make memories that will last a lifetime. And remember, your feedback matters. Please take a moment to leave a rating and a review wherever you're listening to the NHA Health Science Podcast. I'm Dr. Frank Sabatino, your host. Now, back to the show.
Welcome back to the Health Science Podcast. I'm here with Dr. Zach Burns, and we're talking about his interest and his attention to the situation of chronic disease. So as you entered med school, I noticed that you brought that awareness of some of the importance of plant-based eating and living with you into your actual education. So you kind of and created a little organization in med school called Plant-Based Healthcare, from what I read. And that's kind of an intriguing thing. Was that something that you had to deal with, any obstacles to creating? Was there some problem in doing that while you were getting your formal medical education?
Sure. Well, yeah. Before I answer that directly, it's a good point. I remember the conviction before med school that if a group like this didn't already exist, I would create it. So you're right that I must have had some understanding of the role of plant-based nutrition to prevent and reverse disease, but it wasn't until clinical years that I really saw like how badly and ineffectively we were responding to chronic disease. But let's see, was there any opposition in getting our group plant-based healthcare off the ground? Not really. But what I needed to do was meet some like-minded people so that I wasn't just one voice.
Did that happen, or were you finding yourself more on an island, or were there a number of medical students that seemed more, sympathetic to that message, to that idea?
There was this guy, Mark. So we met in the anatomy lab. We were dissecting a cadaver, a 73-year-old specimen who kindly donated his body, and he had died of a stroke, and we were dissecting a carotid artery where there's often a blockage to produce a stroke, as you know, and there was all this plaque, and we were teasing it out, and we started talking. We went from kind of talking about the anatomy to I don't know how we got to nutrition, and then we kind of discovered, we looked up at each other and realized that we were both herbivores or vegans. So that's when I had a partner in crime in starting plant-based healthcare.
Cool. And so it was with that group that you started, I gathered that you were bringing in a number of speakers, and then Michael became one of those people. You became aware of moving medicine forward. Talk about how your relationship with Dr. Klaper evolved, and how you became connected to the movement that he was really setting in motion.
Sure. Well, I of course knew him before he knew me. I saw Cowspiracy, and he has that scene where he's talking about baby calf growth fluid.
Right.
Do you have big ears? Do you have a tail? Are you a baby calf? And I thought it was so hilarious and endearing. And I really liked his balance of conviction, but also humor and sort of his voice among all these pioneering plant-based docs, I think, resonated with me most. Right. So I was a huge fan, and we were really active, this student group, because that was my thing. I was trying to wire up the whole campus network, and we were not only having speakers and film screenings and journal clubs, but we were doing things like, petitioning other student groups to commit to reduced meat purchasing at their luncheons. And we were doing some advocacy on the local level. And one of the things I did as a moonshot was submit a note through Dr. Klaper's website asking if there's any chance he would want to come and speak with us. And I honestly didn't think we'd get a response. This is a busy guy, and I was a no one. And we also had no budget. That was one of the things that the university allocates some funding for student groups, but it's like we had to be a group for longer to be eligible. So I really didn't think it was going to work, but he responded promptly that he would love to come and that no compensation was necessary. So then we were about 2 months out, and it was a huge concerted effort involving us on campus, but also the local South Florida community. And we put together quite the event.
Where were you at that time? Where were you in medical school?
Nova Southeastern. Yep.
Yeah, it's not far from me here.
Nice.
Yeah, so then you got that together. Michael came, and then of course he does his thing, and his thing is impressive, of course. And so was it something that turned on a lot of the students at that point?
I think so. A lot of students came up to me afterwards that day, but also in the weeks and months to come, and talked to me about how that was moving for them, how they didn't really grasp the power of diet in preventing and reversing disease. And
Right.
Some people said that it was going to influence the way that they would practice, and maybe, the discipline that they would pursue. It certainly had that effect on me. I remember his slide about how that each bite of food kind of goes in, it's absorbed in the GI system and circulates the blood, and then washes over every cell in the body and plays the genes like a piano, right? And I'm a piano player, so I was blown away by that analogy, sort of the confluence of physiology and music, because it's true. The profundity was that that is the case, that all of our environmental exposures have an epigenetic effect, and that is likely part of the mechanism of why food is so powerfully therapeutic or not.
And so from that point forward, did you maintain an ongoing relationship somehow with him, or was there an intervening time, and then when you became a physician, you became connected with his movement? Talk a little bit about that evolution, if you can.
Sure. Yeah. Starting that day, I think in advance of the speaking event, I had volunteered to help with any endeavor that he needed me for. Also a long shot, but he was, at the time, he wanted to start something like what became Moving Medicine Forward, in that he wanted to focus the rest of his career on medical education, to try to expose med students to plant-based nutrition where it is deficient in the curricula. So he needed someone on the ground, a med student who understood the infrastructure and could connect with other med students around the state and the country. And I was in the right place at the right time. And I think he saw how serious I was about this. And so he took me under his wing, and we started Moving Medicine Forward.
And so that took you all through your medical education till you were actually out and became a licensed physician. And then you came on as the assistant director at that point after you became a physician. Is that how it came to be?
Exactly. So I was volunteering pretty actively for the last 5 years. And then when it was time to figure out my life after residency, I pitched him on, a part-time role with the organization, an official role, which he and the board have kindly granted to me. So I'm the associate director of Moving Medicine Forward, and that's alongside my clinical role, which I've yet to start. So I just graduated residency in June, took the summer off.
You mean the residency in family medicine? Is that what we're talking about?
Right.
Okay. Yeah.
And
so talk a little bit about your role and what you see that organization doing and how it's working, because not everybody knows what it is. So maybe you can communicate with the audience a little bit more about the real nuts and bolts of Moving Medicine Forward and what your role is with it, and what's happening with the organization.
Sure. Well, so this is an aspirational effort, as the name suggests, moving medicine forward. Medicine is like a tank. It's like a chunk of rock. There's so much inertia, and to move anything forward is quite the effort. And what encourages me is that we're doing it alongside so many other important organizations like yours, like the American College of Lifestyle Medicine, different organizations that are not only doing lifestyle medicine, but also targeting medical education. That's really that's the premise. We recognize that there's a loose guideline that's not even enforced, but that a medical school should have 25 hours of nutrition education. But most medical schools don't, is my understanding. And when there is nutrition, it's often, talking about vitamin deficiencies, which are really more an issue in developing countries. We don't talk about how the standard American diet has precipitated this chronic disease scenario. So that is a glaring omission. And our role is to identify students who are passionate about this. Maybe they've seen a documentary, maybe they've been to a conference, but they have some understanding. So we connect with them and do teaching, and also help them to cultivate their skills as a social organizer, right? As a community organizer, so that they can, say, create a student group or network with faculty to implement a new program on campus, something that can get the ball rolling and start to expose more of the class, or ideally the whole class. And even better, if there's a sustainable organization that's going to survive their graduating, because there's a lot of turnover in these institutions. So we have some strategies to institutionalize the plant-based message in medical school where it's missing.
Zach, let people know where they can find you. So I don't want to get past to our time where they, what's the URL where they can find more about what you're doing and what they can learn about what you're doing? Where do you want them to go?
Thanks. It's herbivores.life.
Herbivores.life. Okay.
And our listeners might enjoy the writing or blog section. I do some creative writing. It's not all plant-based nutrition. I am also, as mentioned, an ethical vegan, and I talk about what I see as a vegan going about this non-vegan world. And I try to put some humor into it, so you might dig the writing.
Yeah, I think that's awesome. Yeah, when you talk about trying to change a medical curriculum, I'm thinking about the fact that you're representing such a paradigm shift that you made the point that the inertia is so entrenched. And if you think about the professors and the physicians and the infrastructure of medical schools, I got to believe that it's got to be a yeoman effort to try to even make a small dent on that paradigm, which doesn't even believe that chronic disease can be fixed. I mean, their basic paradigm is that you just manage it. You've got type 2 diabetes. Let's just make sure we manage it. You've got heart disease or high blood pressure. Let's put you on high blood pressure medication for life. We'll just manage it. So what kind of, what are the real obstacles that you and Michael and other people doing the work now in the trenches, what have you encountered? What kind of resistance have you encountered, and how have you been able to create some overcoming of that resistance? Talk a little bit about that if you can.
So we haven't had much resistance. And to me, that means we're not doing enough yet, right? That we're not, because it's only when there's friction that the opposition feels threatened, right? That's the sign of change. I'm sure for example, the ACLM does some like broader advocacy, and they're working on board exams, and they're working on insurance reimbursement and these sorts of things. I'm sure there's opposition there. There's real political opposition. On our level of direct education to medical students, there hasn't been. Actually, faculty and students are quite receptive on the whole. which is
I'm
good.
envisioning faculty members standing in the back of the room with their eyes rolling back in the back of their heads while someone like Michael is presenting that information. But maybe I'm wrong. It sounds like there's a little bit more acceptance than I even thought, which is great. I think that's fabulous.
Yeah, I think there's more and more acceptance. I think also we sometimes bypass those holdouts. I mean, they're not really invited, to be honest. Maybe we should try to, but sometimes these events, we're going directly to the students. We have our little networking apparatus, and we find motivated students, and they put on an event and they invite whoever they're going to invite. It's not like it's exclusive. They're going to send out a campus-wide email. But if there's a curmudgeon who's not really inclined toward these things, he or she just might not show. But here's the real obstacle, in my view, and I'm excited to get to speak about this at the Plantrician Conference next month. I think the real obstacle is the pharmaceutical industry. Now, I know it's not so groundbreaking. We know that but I really think that it's underappreciated how much of an impediment pharma is in the widespread adoption of plant-based nutrition or lifestyle medicine. Because here's the thing, when we have most clinical research funding going to drug development, and when those clinical trials are conceived and designed and conducted and analyzed and promoted by the manufacturer of that drug, which of course is a glaring conflict of interest. When we have that situation, how could we possibly approach chronic disease through the lens of basic lifestyle? Instead, we have this army of pharma reps, and I started to see this as early as third year of med school. And they go after med students too, because they know they'll be writing scripts for a career. And if you have someone selling Invokana or Ozempic, and they just came to the office and they're really sweet and establish rapport and provide some samples, okay, and then they also hook up the office with the Italian lunch. It's no wonder that some doctors are prescribing that medicine pretty much as first-line therapy, pretty much immediately when someone's A1C goes up to the diabetic threshold. So that's and pharma controls not only the marketing like that, but the guidelines themselves, right? Because they send these, they have their quite biased clinical trial, and then they varnish the results, right? To make it look favorable. Then only then do they send it to the medical societies, the American Heart Association, the American Diabetes Association, for them to make their secondary analysis. They send it to the journals for them to publish the big groundbreaking study. And then these meds are swiftly incorporated into the guidelines that doctors are very excited to stay up to speed with and to practice by. So I saw it play out in residency, where there's a huge buzz, for instance, around SGLT2 inhibitors like Jardians, and there's just a fanaticism. It seemed as a skeptic, right, as a sort of someone who understands the power of marketing, can see through marketing. I wondered, where is this buzz coming from? And so I started to look into trials really, really systematically. I met someone who's a leader in this field, to John Abramson, who has two really powerful books exposing the pharmaceutical industry. But I started to, it turned my world upside down, because I saw how corrupt pharma really was. It's not just that they have lobbyists, it's that they have captured modern healthcare.
Well, Zach, I go back, and the bottom line is this idea of exchanging trips and rewards for sales of drugs. This goes back to the 60s and 70s. So we're talking about something that's such an ingrained process with Big Pharma that they've been doing this for decades. And the fact of the matter is, all those things you laid out are all financial investments. So they want an ROI, they want the return on the investment. And when you're looking at lifestyle medicine, you're looking at things that are not proprietary. I mean, you're telling people to eat well and move more and handle stress better and sleep better, and no one's making bucks from that. And so the pharmaceutical company can't. So of course, so how do you see bucking that? I mean, when you think about how entrenched that is in the whole infrastructure that you described, talk about how you see solutions to that.
Thank you for that question. This is my chief interest right now, is how to respond to that monolithic impediment. Well, I think a few things. We need to tell this story in our movement in plant-based nutrition and lifestyle medicine. So just as we're telling the story of atherosclerosis to med students, we need to tell the story of pharmaceutical influence. Number one, it helps explain to those med students why it gives us credibility, because otherwise they might say, well, this seems plausible. The physiology makes sense, but why are you the only one? Why haven't I heard this before? Is it possible that this isn't true? Because none of my professors are talking about this, right? But if you tell that story about why our progress has been thwarted, then I think it makes more sense and lends credibility to our cause. And let's see if I had another part of that. I think the other thing is, I think part of our movement, in addition to advocating for, in a positive sense, for lifestyle medicine, we really need to be active in the fight to rein in the pharmaceutical industry. I actually don't think that we can achieve widespread adoption of lifestyle medicine until pharma is properly regulated.
And it's interesting because it's not universal in that regard, meaning that if you look at it, we're one of only maybe one other country that actually does drug advertising on television. So when you look at it, it's such a fundamental American approach to healthcare that has really established this. It's not that other Western nations don't have it, but they certainly don't have it to the extent that we do. When I was doing a paper on attention deficit in children, we have 5% of the world's population. We use 95% of the drugs to treat attention deficit. So the question I always pose, what's the rest of the world doing? I mean, they're not, so we need to look at the fact that this has become such an indigenous part of the American way of life too, which is really mind-blowing in itself. So it's a big to do to crack that nut, so to speak. Let me ask you a question, because I noticed that we're talking about the health considerations related to plant-based living and the impact on disease reversibility. I noticed that you were also a liaison with medical groups for like a sustainable future, and also your interest in universal healthcare, things that were kind of passionate things for you. As you do this teaching, do you find that you're going beyond just the biological and physiological well-being of people with the consciousness of these students? Is it coming into the play of compassion and sustainability and the impact on animal rights and animal welfare and the environment? Are you finding that that part of the story is also spreading as you teach the physiological component?
Absolutely. Yeah, both within and outside of moving medicine forward, I do some talks. One is called Food, Environment, and Zoonotic Disease. And this came out of COVID, where we needed to, like, following many other docs in our movement, we needed to tell the story of zoonotic infectious disease and why we were getting so many novel pathogens, and also how people on a plant-based diet responded so much better to COVID. They got sick less, and if they did, it was a much less severe infection. So some of these neglected areas, and I talk about the ecological piece where as we encroach on habitats and have these obscenely unnatural concentrated animal feeding operations, it's a perfect breeding ground for novel pathogens. So that was one. It started to get into the environmental piece. I also have a talk called Plant-Based Nutrition for Social Justice, where we examine all the different social issues that are affected by our current food system. So it's not only human health, it's not only the environment, it's not only animals, actually. It's human labor issues,
Right.
it's environmental exposures in the vicinity of these facilities, different things like that. And I try to connect the exploitation of animals in particular to other historic forms and contemporary forms of exploitation of different human populations. So
where are you sharing that information? Is that something you're doing online, or do you do that in summits, or do you have your own workshops online? How do you get that information out to the public at large?
I've developed some relationships with different medical student groups.
I see. Okay.
Throughout the country, and some of these talks are recurring, and other ones I'm happy to get invited. But yeah, it's one of my favorite things to do is to talk about the big picture, and
Right.
and to have an explicit vegan message as a physician, which I think my generation of plant-based docs can increasingly do. We don't have to be embarrassed and of course you haven't been, but a lot of people, it's to talk about for instance, 6 million animals who will be slaughtered just in the US by the end of this hour.
Right.
Let's not forget about them, or the other issues stemming from factory farming. So because I think my generation and the medical students are really interested. One of the critiques, if there is a critique, it's often from the left, and it's saying, well, plant-based nutrition is not accessible, it's exclusive. You've heard this sort of critique, and that's the last thing we want to do is exclude underserved populations. In fact, most of us do this because we know it's the only way we can properly serve people who have been disadvantaged, because they are hit hardest by chronic disease, and they will benefit most when we can reclaim the food system and the healthcare system.
Well, what's the activism involved in that in terms of dealing with food accessibility? Are you hooking communities up with food banks, or are you hooking people up with people that are donating the kinds of foods that these kind of disenfranchised populations should be exposed to? Are you involved in any kind of outreach that way, any kind of activism in that regard?
Yeah, wherever I'm practicing, I want to make sure I'm hip to the community resources so that I can refer people and get. So for instance, in residency, I just finished a couple months ago, it was a community health center, and we had a farmer's market outside where you could use food stamps, and even within the clinic you could get a free grocery bag or two. So making sure that people had these resources, for sure, that's the first step. And as I start to practice in Rochester, I'll make sure to refer people to similar organizations. And I also want to start this thing, and you heard it first, that where I just hand out fruit. I want to have a fruit bowl in my practice. We'll see if it doesn't violate some kind of policy. But that is my goal, just because some people, they just have not had fruit in days or weeks. And if I can just get someone an apple, right?
Right.
We do have research, because of the silly phrase, an apple a day, we have research on what an apple a day actually does, which is, from the paper I read, reduce the incidence of diabetes by about 1/3. I mean, it's ridiculous. So things like that, but also education on directed at med students and patients on how we can talk about plant-based food accessibility. So because there are a lot of misconceptions, about 95% of the American public per national data actually do have access to a full grocery store. But I think there's a lot of education missing in how to go about that, how to walk around the store and what to throw in the cart that's cheap and how to prepare it. So it's on us as providers to have some of those conversations about what you can get with what you already have. This isn't about getting having a big career change and making twice as much money. It's, as they say, meet patients where they are. What kind of grocery store can you visit, and what can we do there? Because almost every case, the shopping and cooking can be quite healthy on pretty intense budgets. So,
and there are a lot of online resources to show easy food prep, and many things people have access to now. That's beautiful because it's available, and they can go online and they can go to various organizations online that take them through easy food prep and inexpensive food prep, because of course everybody thinks this is so much more expensive than everything else, which is a lie. One of the big lies that usually prevent people from making some of this change. But yeah, so things are more available, and I think that's fantastic. So Zach, as we will kind of wind this down, are there any final words you'd like to share with the audience out here?
Well, one more piece to finish up on that last point is that we did shop with a doc in Providence.
I was going to ask you about that.
Yeah, so that was another way, sort of direct education. You recruit patients and people in the community, and you take them physically around a grocery store. And that was such a powerful thing for me to witness. It was really moving to see these people, because at that point they were ready, right? They were ready to change. And I saw people with overweight or obesity or heart disease who were sick of being in pain and living sort of precariously and having all these appointments, taking drugs. And I saw them put the kale and the chard and the beans and grains in their cart. And I saw them fill up carts with this stuff. And there were people from all walks of life. These were not elite people. And that was really gratifying. I felt like I was practicing in a very sincere way. So
very rewarding. Amazing. Yeah, it's very rewarding. All the retreats I ran through many years, that there was always a component of that. There was always something we did in the week where we went shopping, and it was one of the most attractive programs that were part of the program. People loved that because it was very practical. They could see how you pick ripe fruit versus unripe stuff, all the various kinds of things that they could do within their reach and power to really improve the quality of their life and nutrition. So that's a very rewarding exercise to do. So,
right. And in terms of any parting messages, I'd just say, I hope that our listeners, if they haven't had this sort of awakening about our relationship to other animals, that they can discover that in their own way. And an easy way is to think about your dog or your cat and how much you love them and how you'd fund their veterinary care and everything. And then if you just gave an ounce of that love to other species, say pigs and cows and chickens and turkeys, then we probably wouldn't eat them. And it's scary to think about a fundamental shift in one's diet. I was scared to go vegan. And then I realized that the fear was unfounded, that it was actually really easy and really gratifying, because whatever innocence I lost by becoming vegan was in whatever like indiscriminate consumption that I had practiced, those things were overwhelmed by a sense of sort of peace that I had, that I was being myself, that I was being authentic, and just doing a little piece that I could to alleviate the plight of these animals who are our friends ultimately, and don't deserve what we're doing to them.
I agree. I can't thank my guest, Dr. Zach Burns, enough for sharing his time today, his heart, his inspirational message. I urge you to follow Zach, look him up. You see the URL scrolling across the screen. Take advantage of the information that he has to share as we kind of try to transform this world into a little bit more of a compassionate, loving place, which we all want to do, a healthier place for all creatures on this planet. And I really want to thank the people that have joined us here today, because without you, we can't do what we do. And I want to thank you for being a part of this very active, healthy community. And on behalf of the National Health Association, I'm your host, Dr. Frank Sabatino, and I look forward to being with you on the next episode of the Health Science Podcast. Thank you, Dr. Burns, so much. Thank you.
Thanks.
You've been listening to the Health Science Podcast, brought to you by the National Health Association. Thank you for joining us today and for your commitment to evidence-based health science that backs a whole food, plant-exclusive lifestyle and contributes to the well-being of all people, animals, and our environment. I'm your host, Dr. Frank Sabatino. Be sure to leave a rating and a review, and we'll see you on the next show.